Hey, we're the Turd Nerds. We're glad you're here. Before we take the plunge, let us introduce ourselves. I'm Dr. Rebecca Sand, a naturopathic physician and licensed acupuncturist specializing in digestive, microbiome, and hormone conditions and integrative fertility.
I'm Dr. Ami Kapadia. I'm a medical doctor trained in family medicine and functional medicine with a special interest in combining standard therapies with lifestyle and nutrition-based interventions.
And I'm Dr. Alana Gurvich, a naturopathic physician, licensed acupuncturist, and a fellow of the American Board of Naturopathic Gastroenterology. I specialize in IBD, IBS, and other functional GI disorders. Let's dive in.
The following discussion is for educational purposes only and not intended to diagnose or treat any diseases or conditions. Please consult your doctor before incorporating any of this information into your care. The information presented on this podcast is not medical advice.
Welcome back. We are super excited today to have a very, very special guest with us, a very, very old friend, a really, really close colleague.
She is young, I'd like to be clear.
So we're all
But you
young.
know
Her name is Dr. Meghan Larivee, and she's a naturopathic physician and Masters of Oriental Medicine acupuncturist. But really, the reason why we're bringing her on here today is to talk to us about a topic that we have not covered yet.
It confuses us.
Which is the skin-gut axis, axis, which every time I read a new study, I read something else about how the GI tract and the skin are intimately related.
Well, we have a microbiome on our skin.
True. And I had no idea how the microbiome on our skin is related to the microbiome on our GI tract.
Patients always get really grossed out when I refer to the bugs on their skin. They're like, can you use a different word or something? But I mean, that is kind of gross.
So, Dr. Larivee, will you just start by telling us how you even got into this?
Great question.
Great question. So ironically, it was actually at a gastro conference, and there was a presenter presenting on H. pylori, which is a gut bug, and how it manifested on the skin. And honestly, I don't remember what skin condition she was presenting on. I think it was acne. But either way, it was fascinating and it piqued my interest. And I was like, oh, because in particular, and we'll get to this later, but H. pylori we think of is just in the gut.
Yeah, ulcers, reflux, maybe cancer.
Gastritis, cancer. It's controversial to treat it, unless it's super symptomatic. And a lot of times, or not a lot of times, but people aren't always, when they have a skin stuff going on, they don't usually have significant GI complaints. I mean, sometimes we'll find out, they have some constipation or bloating, but that's not their chief complaint.
I always feel like when someone mentions acne, I'm like, but you have bad gut issues, don't you? Like you're bloated, because I want to test them and do this stuff. But are you going to tell me that we should test anyway?
Yeah, I'm going to tell you should test anyway.
Okay, so can you just?
I don't think it's the H. I would not go as far to say that H. pylori is causing acne, but what the H. pylori is doing is disrupting the gut microbiome, which is disrupting immune signaling in the gut. Which then, if you've got a compromised skin barrier, it's going to keep driving that.
Right. So it has to be someone who's susceptible, since most of the world has H. pylori, right?
My understanding is about 50%. But that's a lot.
It is a lot.
Okay.
Yeah. Everyone have that.
Can we go? We're going nuance. Can we please go a little bit big picture? Can you pull us way the hell out? What happened?
Okay, so I was at that conference, and essentially the real gut axis or gut skin axis is that intersection of thinking of the skin as an immune organ. We know the gut and the gut associated lymphatic tissue is a ton of immune system, but it has a ton of immune functions. Yeah. But the skin is actually the largest immune organ.
I don't ever think about the skin.
People say this every year to me, and I completely forget.
Can you just explain what the hell does that mean? That the immune is the skin, or is that immune function?
So first of all, it's got its whole level of innate immunity, which is kind of the pH of the skin helps with antimicrobial peptides and signaling, and it helps regulate the skin microbiome, which that in itself also regulates the immune system. But then just below, a little bit deeper, it's full of mast cells.
Oh, yeah.
We know that.
Keratinocytes. Actually, keratinocytes are kind of the building blocks of the skin. That's how we've always thought of them, but they secrete cytokines and interleukins.
Whoa.
There's resident T cells, there's dendritic cells, there's Langerhans cells, all sorts of immune cells. So the skin is replete with it, and it's constantly negotiating with the outside world. And same immune tolerance that we're much more well-versed, I think, in the gut about, is this a good guy? Is this a bad guy? Should I react? Should I not react? Same thing. You've got the dendritic cells sampling the surface and your external, what's coming in, external environment, and communicating deeper, no, we're chill, we don't need to react, or yes, this shouldn't be here, or this is off, and I'm going to send signals systemically.
So I often think it's just local. You get scratched by a cat or touch something you shouldn't touch and you get like a local rash, but you're wanting to really emphasize there's an interplay that goes to the whole body.
When things become chronic, healthy skin is really resilient. Yes, we're going to get scratched by a cat and we're going to get a bug bite and we're going to scratch it and it might get festered, but it's not necessarily going to be, it's not necessarily. With that said, there's something called the Koebner phenomenon. Well, it's more well known in psoriasis, but it's where there's been trauma or an injury to a part of the body that's more prone to getting.
It might be Koebner, but I'm not sure. We usually say it wrong for a while and she just tells us to go with it.
Yeah.
Oh, yeah.
Say it with confidence.
Say it with confidence.
So yes, the skin is designed to be able to withstand an element of like bug bites or cat scratches or trauma. I mean, if you get a laceration, it gets sewed up. But part of that is if the skin microbiome is intact and if the pH is intact, then the skin can repair really well. That barrier can repair and it stays healthy. And so, like, for example, when I go into that innate immunity of the skin, it has a very thin layer of cells on that top layer, and we call it the acid mantle. And it's kind of a combination, it regulates the pH. So it's a combination of like sweat and byproducts of lipids and sebum and oils. And the skin is really happy when it's about 4.5 to 5.5 range. And that's when all the signaling is good and the repair mechanisms are working optimally. But for example, like water is a pH of 7. And water doesn't disrupt our microbiome, but when we take a shower without soap, it still takes about 4 hours for the skin to reset back into that zone. So when you start thinking about the stuff we're putting on our skin and cleansers and soaps, and soaps by nature of how they work to attract dirt particles, they're going to usually be a higher, more alkaline pH. And that can be harder on the skin. Again, healthy skin, it's usually not a problem. But if you start getting dry skin,
right.
And when the skin is drier, it's naturally more alkalinic. There's something called filaggrin, which releases or breaks down into natural moisturizing factor.
That's what it's called.
Naturally moisturizes the skin and kind of makes it a little bit more like pliable and flexible in there. When skin's injured and dry, natural moisturizing factor also gets downregulated.
So like
you get
benzoyl peroxide when people are just slapping that on all the time.
Right. And when you hear of like things are stripping the skin, it's that kind of stuff.
Okay, so is there, if someone has dry skin already, is there like certain soaps that are better that aren't as alkaline?
Yes, I'm more of a fan of like glycerin-based soaps, and just soaps have less
like Dr. Bronner's.
Yes,
Castile is a glycerin-based soap
that doesn't strip your skin.
No, I use the baby one, the baby version of the Dr. Bronner.
Hey, Dr. Bronner's has a baby version?
Unscented baby.
We are not funded by Dr. Bronner's, but we love them.
Yes,
it's actually I've been using it for years.
Yeah, I use Dr. Bronner's exclusively in my house.
I mean, part of it is it doesn't have the surfactants and the sodium lauryl sulfate and some of the other things that aren't necessarily disrupting the pH, but they can be disrupting the bonds that are when skin's like trying to repair and trying to heal. And if you're putting soaps on it repeatedly,
it's irritating it
can
over
further
and over.
irritate.
On the same topic, but slightly different, I was just taught before we came on camera, I was telling these guys that I'm starting to run a bunch of toxicology panels, right? Like I'm having patients who are in chronic disease states and I can't figure out why the stuff that I'm doing that should work isn't working, right? So I'm like, okay, let me just look at your toxic load. I cannot stress how many people these are urine tests. They are urinating out parabens. You know what
I mean? Almost everyone uses stuff with parabens, right?
I mean, I don't
except us.
But I'm like,
I'm sure I do too. And it's got to be in something I'm using that I don't know.
Not too, because it's a big thing with like endocrine disruption and PCOS and whatnot.
Here's the thing though, like taking out what Meghan was just saying, like I didn't even it's like the immune system is picking up those parabens, taking them inside and then signaling endocrine disruption using these parabens. It's kind of crazy.
Have you asked the patients like if they're using stuff? Or are you finding on patients that even say, well, I don't think I'm using anything with this?
So they'll usually be like, well, I use this one thing.
Yeah.
I just find it so interesting that, people self-select to come to us. And not so much to you, anymore, but to come to us, like to come to a naturopath, they're self-selecting.
Yeah.
And these people are generally more aware than I would think. And they're urinating out parabens.
Yeah,
I mean, it's so pervasive in all of our things. The plastic, it's very difficult. I mean, there's some crazy, I think it's these crazy statistics about how much the average teenager, it's like 148 chemicals a day. I mean, when you look at shampoo, lotions, fumes, thinners, shaving gel.
So my daughter, who is 13, is definitely trying to pull that string. And the trick is, as a mom who happens to be knowledgeable about this, I also don't want her to run away from home, torturing her by not giving her parabens.
But I think there's a couple stores. I have some names where you could take her. It's going to cost you. But
they're not as fun as like that.
And they're also not what your friends are doing.
I know.
But even like with a baby, breast milk is usually frozen in
a plastic bag.
And freezing plastic, I learned, is like worse than cooking in plastic.
Really?
Is that true?
Not. I don't know if it was. It was way worse than
It's a temperature change.
thought.
So I imagine.
And it like gets brittle and kind of,
even if it's not heated,
because I freeze soups and stuff
goes
in plastic containers.
I freeze them in glass.
It's a change in temperature that makes it unsafe.
And I run out of the
I
glasses.
didn't know. I thought it was just heat.
Yeah.
That's unfortunate.
I know that. So I'm just like, well, shoot, I'm just poisoning my child over here.
Okay, so basically, let me bring us back on track.
Not on purpose.
Okay,
setting her up for
we did talk about, we're more and more familiar, although there's still so much we don't know. We're continuing to learn about the gut microbiome and the oral microbiome and the vaginal microbiome. Yes, we have a skin microbiome. And as I was reviewing some stuff the other day, and I came across this study, which I love when studies like give you the information you really want, but it turned out there's all these products, and I found it, and it was like, you're gonna have to search the study. We can't say it here, but the actual name brands that disrupt or kill the commensals on our skin. Commensals are the good bacteria, the bacteria that we need that are maintaining that healthy
commonly
immune
used?
interface. Commonly used. I took a screenshot.
Okay, I bet you did.
I want to be able to inform my patients about this. Like I actually know for sure it did say like Aquaphor on there. Like Vaseline doesn't kill the commensals, but Aquaphor does. And it was just a bar graph for about 20 different products, but things that sensitive skin, XYZ for eczema cream, killing the commensals.
Aquaphor works so well though.
So it's a great barrier cream.
Yeah.
It works well on, I think of if you have a lot of cases where you could use Aquaphor, but not necessarily for chronic dermatitis.
Which is what lots of people are using it for.
Totally.
So just use Vaseline.
What if you pour probiotics in it?
Actually, with
yogurt? Mixed with Aquaphor? This is why I don't do derm.
I was more just kind of alarmed, and, like shocked and like slightly angry. Like, this is so unfair. This is the case. And this was an NIH study. It wasn't.
Should we start a product with basically Aquaphor with probiotics?
I think a lot of the medical soaps too, like at work. I started bringing my own soap, but then it takes me so long to get it out, and like I just start using the one that's there.
The medical soaps are designed for like
really bad.
Staff.
I know.
And often the thinking is like, well, it's better to kill all that. But
then we're using it like 10 times a day.
Right. And then you're destroying your rest of your skin microbiome.
This is all bad news today.
That even makes me think of back to the H. pylori. It's controversial to treat it. And part of it is the standard treatment is, 3 antibiotics or 4, like all these things. And it wrecks the microbiome. And there's enough knowledge that usually they're like, we don't really want to treat it.
It doesn't always work too.
Exactly.
I kind of get the feeling we should do H. pylori separate. It's so full of everything in there. Let's put that one aside for now.
It's just a good.
Let's go back to, okay. So now what you are saying is when you are looking at any chronic derm case and you have a series of, who are your patients that you are like focusing on this
Okay.
with?
So what I really focus on are the chronic derm and not aesthetic derm. Although the skin, what I do like about it is this, we see it. Like it's truly much more objective. I mean, there's lots of objective findings, but when people clean up their diet or reduce their stress, it's hard. Yes, their migraine frequency goes down, or yes, their blood pressure goes down, but it's not a reminder typically.
We don't always see people's diarrhea.
So that's one of the reasons.
Sometimes we do.
I do feel to me, it's more satisfying to help people with skin stuff because you get sort of this, it still is a slower process than we want it to be, but it's still direct feedback of like, you look, you see your skin.
So what conditions, these rules, what are they?
So eczema, also considered atopic dermatitis, chronic acne, any acne really. And I've got some interesting acne rules, but psoriasis, rosacea, alopecia areata, which is autoimmune hair loss, and particularly the non-scarring, but sometimes hair loss can start non-scarring and then become scarring. Once it's scarring and the follicle is scarred over, it's really hard to influence and get regrowth. Dermatitis.
Oh, wow. That's a hard one. I see that one a lot.
It's a really hard one. Yeah.
And that's so funny that you say that because I think of perioral dermatitis as really just a localized reaction, but you were saying, no, I shouldn't be thinking of that.
By the time something gets chronic, yes, it starts localized. Yeah. But if you've got something brewing in the gut or stimulating your immune system and sending out like systemic immune signals, and even think about, when I'm looking through the gut microbiome and looking at some of the testing that shows us a snapshot of what's in there, like some of those, like the Pseudomonas, which is an LPS producer, releases the endotoxins. Those are what are going systemic. And again, it's not that I can say Pseudomonas is causing this, but Pseudomonas is keeping immune signaling so that when the perioral dermatitis is trying to repair, can't. Effectively, or it does temporarily. The treatments. Perioral dermatitis is often a long course of like doxycycline.
Yeah, I mean that's what I see is multiple antibiotics, not just doxycycline.
Exactly. Yeah.
Okay, and so So your first look is, okay, I'm seeing these chronic germ conditions. I know that there is some kind of immunological change that happens within the GI tract, right?
If it's gone on for greater than 6 months, I can safely assume that we have at the outside, it's leaky skin and leaky gut.
Okay, unless what if there's a contact dermatitis and they haven't figured out the contact product yet, right?
Potentially, yes.
But wouldn't that still push them more into this chronic state?
It would push, because if they keep getting exposed, they're still breaking down that barrier and still really heavily getting the resident T cells, the signaling out to, and then it starts to become a Th1,
also,
Th2,
they might be more
Th17.
resilient to whatever that thing is if their gut was fixed, right?
That's true.
Right.
It might not trigger them as much.
Okay, well, can we go back? You were just saying, you just threw out some immunology there that I feel like we in this room know what that means, but lots of people might not. Explain what that means. Your immune system are revving and now it's a Th1 or Th2 or Th17. What does that mean?
I don't have that answer.
I mean, it's just the immune system balance. So it gets dysregulated. People switch to more allergic issues and they're not as good at fighting pathogens and that kind of thing.
So Th1 is usually more bacterial driven. H2 is more allergic driven. 17 is
and there's more like if it's
autoimmune.
intracellular, extracellular, viruses, bacteria. It gets really nuanced.
It gets complicated.
Yeah. That's why I'm like,
I have a question too. You go first.
Is like nickel allergy associated with any particular gut thing? Okay, I'm telling you why I'm asking. So when we had to go for to find our wedding ring, we went to this special store because I decided I needed to get platinum because I didn't want to risk it. You spend a bunch of money. Yeah. So then we went to this used jewelry store and my ring says Paul and Diane on the inside, but it's a very nice ring, but it's platinum.
No,
and
are
she
you
guaranteed
serious?
me that if
totally
I had an allergy, she'd take it back. So that's why we got it there. No, we left it on. I liked it. Yeah. Paul and Diane. But so I was just curious about the nickel.
I have a girlfriend of mine. She had a piece of jewelry that was nickel and she didn't know it. And sometimes she would put on the piece of jewelry. I think it was a wedding ring, actually. She would put on the piece of jewelry and she'd get a little rash. And then she was like, you know what? Screw this. I'm just going to leave it on. And then that little piece of jewelry ended up going over her body. She was trying to take a bunch of drugs for it, including chelators. Like that's actually the only thing that she found would work, that the literature supports is using a chelator. But she had to do this really, really crazy nickel diet.
Yes.
Because it sensitized.
So why didn't she get any ring?
Nickel is often like a quantitative, like the burden. Yes, it's the ring. So this is what I learned, and I kind of feel like the hard way. I mean, I listened to a presentation very similar. I had someone that just had this like ongoing dermatitis. I wasn't sure, like the things we were doing weren't quite getting the traction that I had expected, and I was like, all right, we're gonna try the nickel thing. But the thing is, there's so many foods
I know
high nickel,
exactly what you found.
That's very hard to do.
So I put together this beautiful like nickel free diet.
Don't tell me psyllium husk is on there.
Not
it
chocolate
might be.
and stuff.
It's vegetables, rice, brown rice.
Yeah, like a lot of good stuff.
It's wild.
Yeah.
And so back to and this person didn't have nickel, but but then I led her into constipation. She was on this like kind of unhealthy diet.
Yeah.
Because it was like all fiber. And I was like, I can't. We weren't getting any resolution. And in theory, it should be short term because if you can get rid of the jewelry or the known bigger things,
they'll calm down.
Then stop. But some people this was actually, I think that somebody told me they had just been to like a vegan Vipassana 10-day yoga retreat. So they're eating tons, a disproportionate more amount of higher nickel containing foods. But it was like healthy, beautiful vegetarian food. But back to like the skin microbiome, as you guys know, like it's diversity of fiber sources that get that diverse microbiome that keep it more stable, that keep it more robust.
In the skin as well.
Well, the skin, if you've got a strong microbiome in the gut, you're going to keep it healthier on the skin. The skin, it's a different microbiome. They aren't the same bacteria, but for overall immune resiliency. And even we've looked at probiotics that like do well, but nothing does as good as
fermented food and fiber.
Right. And diversity. So when you start cutting all that out, I get a little bit. In general, when I'm working with patients, I'm not big on food restriction. I mean, yes, restriction on like junk food and highly processed foods and sometimes dairy and sometimes gluten. But for the most part, I want you getting as many different like nuts and seeds and grains.
That's interesting because I always think of fats for skin. Like I'm always interesting. We need diverse fats, avocados and stuff like that, like healthy fats for our skin. But of course,
what do you think about that?
I mean, I'm thinking a little bit more of like getting the gut microbiome solid. But I mean, essential fatty acids are critical for cell membrane health and immune health and immune signaling. And so, and across the board, we're all deficient in essential fatty acids. So it helps with inflammation. modulation
Did
as well.
what predisposes, is there a gut thing with the nickel allergy?
Oh.
For someone who got
we didn't answer
that
Emmy's question.
sensitized. As you can see, I really am careful about my jewelry now. So I only wear I don't even risk it with nickel acid, especially after that story.
Yeah. I think it's a true allergy.
But
and so you have
not
to
like
avoid
a gut thing in general. It's maybe not like related to so people probably just get sensitized.
I think that it is a true allergy, right? And then that inflammatory state moves internally, and then it upregulates that response. I will say,
so
I
you have to get desensitized probably.
I have never seen I was like, you know what? So one of the things that I do is for any skin stuff, especially infections, I want to put ozone on it, right? Like that's my mechanism of choice. And I'm sure that's messing with the microbiome for sure. It's anti-inflammatory in the long run, not in the short run.
Actually, there's topical treatments with ozone that are pretty nice because of the anti-inflammatory.
Right.
And they aren't as disruptive. I mean, kind of like garlic, like it's a great antimicrobial and it's usually pretty gentle on the commensals.
Her whole body, I could not put her in an ozone.
Right. I remember also with that case, I believe it was also in the cookware, like another place where
what kind of cookware?
Stainless steel.
Normal.
It's in stainless steel.
It's not in cast iron. It's not in cast iron.
Well,
I just give up?
I think you should give up. Just go to sleep.
No, there's a way to desensitize yourself.
I do
Don't worry.
that.
Okay, we can move on from my question.
One other thing
just
about
wear
nickel.
24 karat gold.
One other thing about nickel is the other place where you find nickel is in sometimes for the chronic vascular insufficiency diseases.
Oh yeah,
they'll implant catheters and stents, and they will have nickel on them.
That seems like an oversight,
right? And once they put them in, they can't get them out. So that's the other place you find nickel.
I had heard. I mean, I
think they use more other medical grades. Metals.
Steel, like it's
it's part of the. See, this clueless I am. I have to take metals.
You don't.
Just ask ChatGPT.
When is this ever going to
These are my constant things that I need to take classes for things I don't know.
Okay, so let me go back. So you have a patient, they're coming in with one of these conditions, these 8 chronic conditions.
For 6 months or longer.
For 6 months or longer.
Does that include nickel allergy, right? I don't think that's part of it.
I'm going to do a stool test because I want to see what's going on with her gut and if there's dysbiosis. So either overgrowth, undergrowth, not enough of the commensals or the keystone species that we've at least identified that are helpful. Like, for example, there's Akkermansia, mucinophilia. So mucinophilia, mucus lover. And my understanding is its role is it kind of eats up old mucus to generate the globule cells to make more mucus, and that mucin lining, which lines our entire gut. And when that gets broken down, leaky gut happens.
Yeah.
But and I know that there's a lot of inflammation because it's that protective layer, that one layer in the gut is compromised. I'll look at a stool test. And then I also like to look at an organic acid test, one of the urine tests, because it gives me more of a snapshot as well. I find that the stool tests aren't the best at looking at yeast.
Yeah, it's really hard.
It comes out, but the organic tests, the oat tests tell me more about if there's yeast or mold exposure. And again, it's a snapshot. So if I see a lot of those, then I'll look into a mycotoxin testing. But
how does yeast and mold, what does that look like in the skin?
The way that it's not always clear.
Yeah. Is it just literally general dysregulation?
Yeah.
Or if you're hitting a wall with treatment, is that where you're kind of suspicious? Is it yeast or mold? I mean, I assume they're just really hard to treat.
So many times I see overlap.
Yeah.
And the skin does have, for example, there is a yeast called Malassezia yeast that's on all warm-blooded mammals. And again, when people start telling them they've got bugs on them, they don't like that. But I'm like, we all have it. Don't worry about it.
They definitely don't like fungus on them then.
No. Yeah. But the Malassezia yeast, it feeds off of sebum or our natural oil production. So they tend to conglomerate where there's hair follicles. So eyebrows, scalp, chest, groin.
Wait, is that the one with seborrheic keratitis? Is that the one with seborrheic
dermatitis? It's very commonly implicated.
Is that what causes dandruff?
Yes. Essentially, yes. But sometimes when something gets more inflamed, you guys, the pH shifts, the whole ecosystem there shifts. So people are like, oh, we're going to treat the subderm or the Malassezia. But it's gotten so jacked up that
pH
now there's Staph aureus. So this is what the Malassezia does. So it comes and it digests the oil, and when it digests the oil, it creates a little bit of inflammation. Inflammation shifts the pH slightly more alkaline. And I think it's above that 5.5. It's not like it's 7, but it's a little bit.
I mean, we know that from vaginal infections.
Exact same concept.
Yeah.
Then what happens is it's a little bit more alkaline, and more of the Malassezia are great, we can have a party, recruit. Everyone goes there. Then you get this perpetual cycle of inflammation because they're digesting the oils, and then people are wanting to put moisturizer on their skin, put oils on their skin. The Malassezia are continuing to have a party because they get more and more.
Right.
And
people think it's just a problem.
Probably the Malassezia might have a problem. Somebody might need to do an intervention.
The barrier gets degraded and vulnerable, and then it's drier, and so it loses more water. It's called transepidermal water loss. Again, just the pH will stay that. So part of treatment, which I'll get into when we go maybe in the next episode,
With British pylori.
is really about continuing to support that pH, and move that to health.
Do you recommend people eat certain pH foods?
No, I don't think that.
Just
I was
fermented
hoping you were
food,
going to say that. Yeah.
probiotic foods. And
the pH, I mean, your pH is so tightly regulated by
Right. Whole pH water craze and all of that.
Oh, I have
yeah,
opinions
yeah.
about that, and they're not positive.
people
Yeah.
are always asking
Seems a
about those
little like a
alkaline
scam.
water
I have-
machines.
I think
Yeah.
your body quickly,
Yeah,
my
it
understanding
changes.
quickly corrects it.
Yeah.
I will
So
also
tightly
say I
controlled.
have seen it way more than once make people precipitate out stones, and then they get kidney stones.
Wait, if they do this
Alkaline water.
Yeah, I don't know.
Yeah.
I didn't know what they were
Paying
talking
I
about.
think it's a
with the
bad
machines.
idea. I think
Yeah.
every now and again is not a bad idea, but I think if that's the only water you're drinking, you are going to precipitate it out.
I mean, the one piece I do like about this, technically, like high sugar foods and junk food, like
Right.
crap foods, are more acidic.
Right. So, it
So
might
if
balance,
it's gonna,
but
I don't know about drinking the water, but I think if encouraging someone to shift their diet, it's really like
but
take out
that's just
junk
like naturopathic diet shifts.
you can't balance
food.
out
You can't. I
your
don't,
sugar with eating the opposite pH foods. Like you got
Yeah.
to probably cut the sugar.
Right. Okay.
but
Right.
it's not going to change your internal pH.
Right.
Right.
Your body,
But
that's what
eating
that-
the crappy food
like
will
you're-
definitely change your internal pH for the negative.
well, eating crappy food, not so much pH, will influence the micro.
Oh, yeah.
Then
We've heard
then the
that.
pH restorative mechanisms and repair mechanisms are just more not working correctly.
Yeah.
I'm always asking people, like, I see what other people are eating, like for lunch and stuff. I'm like, do you know what I have to do just to get through the day? And you guys can eat this stuff. They're usually younger than me, but
Yeah.
anyway.
Yeah.
That is
It's
the
a
thing.
side note.
So I am right now doing a CGM or a blood glucose monitor, not a
Uh-huh.
CGM, because I'm like, because Ami did one like years and years. Like I think you did one like 5 years ago, and Ami made the comment where she was like, I didn't realize that my diet was like the diet of an Indian farmer. You know, like I was eating
Putting me to
tons of
sleep after
rice.
lunch.
So I'm like, I've been wanting ever since you did it. I've been wanting
Yeah.
to do it, and I finally am doing it. But it is very interesting to see what spikes me and what doesn't.
This is your first glucose
This is my
monitor.
first glucose monitor.
Why?
And you know what's interesting?
Amazing.
What
They're really cool.
spikes me
Yeah.
is like I went out and I shared an ice cream yesterday. That spiked me a little
wasn't
bit.
it.
It's got the fat in it.
Yeah.
Like bread. I eat Ezekiel bread. Even Ezekiel.
Yeah. Oh, I thought Ezekiel bread doesn't. One of my colleagues told me.
It spikes
for
me.
her, I
Versus-
guess.
It's so bizarre the patterns you figure out, but I've had so many patients where it was like they could eat bread, they could eat cheese, couldn't eat pizza. That's happened to 3 people that
Huh.
I've been privy to.
It's
It's
also
best to
wild.
just remove the monitor at that point.
I know when it came to pizza, I was like, I'm sorry, we're breaking up.
I find it very inspiring.
No,
Yeah.
it is. It's super helpful.
We'll sort of tie this in. What's kind of wild, I was going to talk about acne, and not so much acne.
Oh,
in the
blood sugar
microbiome.
Yeah, you said you had
fluctuations.
some pro tips
So,
there.
so a couple things with acne. I mean, acne is essentially why we see particularly like acne is really common in puberty, because we're getting a lot of growth happening.
Mhm.
Like the skin is growing, and so we're getting more skin cells multiplying and more oil production to kind of like help that stretching and growth of the skin. The pores or the follicles essentially get clogged up with cells as they're sloughing off, and then bacteria gets in there and festers, and we have a pustule and the classic acne.
Festers and pustule.
Yes, I learned from.
What?
I do want to say part of also what inspired me is I took this course from one of my mentors, Dr. Julie Greenberg.
We're gonna try to have her on the podcast.
Yeah.
too.
Super smart.
Super smart and really put a lot of this together. But she presented these studies with acne, and apparently there was it's a completely a disease of industrialization. So they did a retrospective study in Japan, Okinawa, where they looked at anybody who had been a physician for between like 8 and 15 years, and this was pre-World War II.
Mhm.
All their notes, there was zero sign of like a pustule or acne. Nobody described acne.
This
And
was
they-
in
they-
Japan.
This is in Japan. This is before World War II.
Yeah.
So, and then more recently, I think like in the now they looked at a tribe in South America. We'll go South America. I think it was in the Amazon, who really had zero outside exposure to modern civilization, zero acne.
Even in
they looked at
adolescence.
this tribe for 2 years, and somewhere I think Papua New Guinea. This was a smaller study. It was like about 1,000 people. Zero.
So you said it's an
Zero.
insulin response, right? A lot of it is an insulin
Well,
response.
insulin response, and I think
Androgens.
microbiome and androgen. I mean,
But-
androgens are stimulating the growth.
So that one is easier, I think, to treat. That non-androgenic, although
but
you
is the
can have,
sorry,
you
go
can
ahead.
have types of androgens that convert in peripheral tissues that you can't actually test for. But, like non-androgenic, overtly acne is for me the hardest.
And so that can be like the malassezia, like the fungal acne.
Oh, there's
Androgens
fungal
are,
acne?
yes. And that's like often the baby acne. I mean, yeah, there's a lot of hormones
right,
going.
right.
Oh,
lady,
baby acne,
but baby
right?
acne more
Fungal.
often than not. And again, by the time
makes
something
sense.
presents, it can be a mixture of multiple things. And when we don't routinely culture acne because it comes back as a lot of commensal or normal flora.
But people that are just blasted with antibiotics, oral or topical for their acne, and they get worse, should we consider fungal?
Absolutely.
It often helps, though. But wait, I have a question.
The people who come to me, it has not helped.
That's true.
That's
okay, Dr. Sand, the androgenic part, isn't that also fueled by insulin, though?
Yeah, the androgen and insulin, and that's the classic PMOS.
Yeah,
it's because the androgens drive sebum production and increase it.
So but is the increased androgens often driven by increased insulin?
Yes.
Okay, that's what I was trying to get to.
Okay, so but here let me bring it back just a little bit. So, I see acne patients all of the time. They are slathering themselves with different products. Those products are teaching the topical, but what you're saying is we should just drop it and test their GI.
Put a CGM.
Yeah, and part of their slathering and the topicals are probably shifting their pH, so then shifting the skin microbiome. And a lot of acne products, because you just want to you think it's oily, my skin's oily. So these things that truly strip the skin. And so then the skin's like, oh, I'm stripped. I need to produce more oil. So you're really just driving the cycle. Like it might calm down like that blemish, but the whole skin is responding in a sense like I'm trying to bring it back my moisture, or I'm having increased transepidermal water loss, which starts this inflammatory cascade.
It's insulin to increase androgens to increase sebum.
Yes.
And then there's also some other gut.
Increased sebum will help to moisturize the skin.
Oh, but also increases acne.
Yes.
Okay. Gotcha.
And if it's too much, it's hyper responding.
A little, like one little guy or like 2 or 3 little guys and like a pimple patch.
You've never had a pimple in
well, I've definitely had pimples.
Years.
I'm more thinking about my adolescent daughter. But I have definitely had pimples in the last 15 years.
I've never seen you have
That's
one.
very, very sweet.
Wait. So you said you have a couple acne tips. I want to make sure we don't miss that.
Okay. If you can eat 35 grams of fiber a day,
how about
insulin response?
Exactly. But the microbiome,
Cilia.
I just want to make
She's
sure.
She's obsessed with that. How else are you going to get 35 grams a day? Who can eat all of that?
You know what's wild? I don't actually take psyllium husk.
That is wild.
Isn't that crazy?
Because you are constipated. Probably not as bad as you were.
I'm not.
Oh,
okay. Childbirth. I don't know what.
It cured you?
Yeah, with my I was on Integrity like 4 milligrams.
When I was my resident, I swear to God, she was like a precalipride rep, basically, with her love of it.
Okay, so the first tip is to eat 35 grams of fiber, which is very hard to do.
You need to ask ChatGPT to give you a menu. I mean, to diversify.
Blueberries are not high in fiber. I know everyone thinks they are. But
nothing is high in fiber.
You got to add
nothing is high in fiber.
You got to increase
psyllium husk.
Psyllium husk. So psyllium husk.
You need a lot of things.
Do take date. You need a lot of things.
Okay.
But as far as high yield fiber foods, blueberries would be on my top 10. Lentils, black beans.
You know what I have people do now is get bags.
Wait, I want to hear a top 10.
Oh, sorry.
Oh, I love oatmeal, but it spiked my CGM.
It spikes everyone's blood sugar.
You just need to add more fat to it.
I do. I use a cashew
chia. That's what I was going to say. I have people buy those big bags from Costco.
You got all the stuff
chia, flax, and hemp.
Is it combined?
On everything.
Oh, is it combined?
You can, but you have to keep it in the fridge or freezer.
Okay.
I will also say just a little plug, because sometimes we plug recipes here. Chia pudding.
It is really good.
It's so good. It's so easy to make.
You make good chia pudding.
So I think I go 1 to 3. So I usually go 1/3 of a cup of chia to a cup of milk. I put cardamom in. I put cinnamon in. Cardamom is like magic. I put a little bit of salt and a little bit of maple syrup. Then you just like literally that whole process takes me less than a minute and a half to make. Stir. I don't shake. Stir. Put it in the fridge because it clumps. If you shake, it clumps. I feel like if you stir, it does. I don't know. That's just what I found. Maybe I'm
okay. So chia stirred, martinis shaken.
There you go.
Okay.
That's how James Bond did it.
So you have to eat a lot of different high fiber foods to get to this 35.
Yeah. Okay. And I think if you're constantly shooting to get to 35, I mean, really,
you got to plan ahead.
Like our healthier, if you will, like population is really like low 20s.
Yeah, it's hard.
And standard American, I think it's like 10.
And if you're a peri or postmenopausal woman,
you need even more.
Feeding you protein. You're not going to have room for that much fiber.
That's the problem.
You have a good recipe for this fiber muffin that I've been wanting to make for about 10 years.
Oh, yeah. I call it my poop muffin.
I've never made it.
I don't know it off the top of my head.
I have it. I just haven't made it.
Do your kids eat it?
When I make it and if they're in the mood. My 10-year-old right now is lovely. My 13-year-old is difficult with food. She loves the parabens. Parabens and processed sugar are her favorite.
Like pimple patches. I mean,
I get to school with those now.
I like it in the sense that it's, it's just affecting like a small area and it's not disrupting everything.
What is it?
It's like benzol.
Benzol peroxide.
And then benzol peroxide, for the record, isn't super stripping. Like when you look at all the stuff,
Wild.
like
It's drying.
it's drying.
yeah.
It's more drying.
But
But when I'm trying to sort of triage all the things and
it's not
conventional
as
things,
some.
it's not in my
It's not the worst thing.
Right?
Okay, any other quick, we have a minute or two left. Any other quick action?
Dairy.
Yeah.
Dairy drives androgen
So
production.
here's what I have really
and
found.
growth.
A2 dairy for a lot of people. I'm
Coming from someone who's
Obsessed with dairy.
Yeah, no, I love
But
it.
you-
Okay, let's let the derm person tell us.
But I'm curious if you do trials of A2 only, if that works for some
I
people.
do not know, but
Okay.
what I do know in this has been fairly well studied. It's actually now showing up in conventional derm books. For the longest time, they're
I
like, diet
know.
has nothing to do with skin,
Crazy.
nothing, maybe chocolate. And then they're like, okay, fine.
Maybe chocolate.
Dairy, particularly leucine. So foods that are high in leucine.
Like
what's
what?
high in leucine?
Dairy. And also meats can be high in
Mhm.
leucine. And certain, I have a chart and I can't remember.
Yeah.
We'll have
Anyone
to-
can Google that.
I feel
Yeah.
like golden sheep might be different, but I don't know. It could be personal.
Okay, it's coming
too.
from Dr. Kapadia. We give Dr. Santa a ton of slack because she wants everything to have dairy when
I
they
do
do.
treat people for a lot of food sensitivities, but I can eat dairy now after many years of not being able to eat dairy, so I could be
And
biased.
I also will say, you're not struggling with acne or chronic
Yes, I
skin
am.
condition.
You
What's
are?
postpartum acne? Yeah.
Okay,
Where?
well, the dairy is going to drive it.
We are on YouTube, and just to confirm,
Yeah.
I don't see anything in the same room or
It
on
will
YouTube.
drive androgen
Amazing.
production.
It stimulates androgen.
All dairy?
Stimulates growth and sebum production.
Oh, gotcha. In general. So, okay.
Like subtly.
Yeah,
I mean, it's not
yeah.
like you have dairy
Yeah.
there subtly.
I wonder about
Kidding.
yogurt. Okay.
Because yogurt is
dairy.
fermented. I would say that what I'm hearing Dr. Larivee say is if you're chock full of acne and acne is your biggest complaint,
Right.
cut out the dairy.
Right.
But if you're not, if that is not your pain point, you have other pain points, don't worry about that one.
Then yogurt's probably a good
Okay.
food in general.
Okay, that was great. I am left wanting more, a lot more, which is good that we're having you back for another episode.
For maybe more specifics.
Okay, can we just do a recap?
Uh-huh.
Can we do a recap?
Yes.
So recap. The first recap that I'm remembering is basically the skin is actually your largest immune organ,
Wild.
doing a bunch of innate and acquired
Adapted,
immunity.
yeah.
That's amazing. Chemicals, often people will try to soft skin people by peeling, by using these very strong strippers, and that
Wait,
makes
and
it worse.
it's not even like strong strippers. It's all the stuff.
really like
It's all the
strong
stuff we put on our
strippers.
body.
Together.
All
just
different
doesn't-
chemicals, all different chemicals.
Yeah, yeah.
Like
Chemical soup.
The
Yes.
parabens, the
Yes.
emulsifiers, the stabilizers,
Yeah.
the polysorbates, the sodium lauryl sulfates, like all these additives
Yeah.
are in our stuff.
My
So
big-
use like a glycerin-based soap.
Right, we learned that.
My big takeaway is if it's been going on for 6 months or more, you want to consider leaky gut and the
Some
causes
systemic
of that.
issues.
Yeah.
It's a combo of leaky gut and leaky skin.
Yeah.
And the same
skin.
principles of leaky skin are happening in the gut.
Yeah.
I mean, literally, the barriers are breaking. It's vulnerable, more hyperpermeability. And so the allergens and outside stuff that might not be a problem still triggers that immune system.
Crazy.
That's great.
Okay, and then the top acne tips were fiber, 35 grams from multiple food sources, which can include blueberries, even though I've looked at the alcohol. It's probably good in combination with other foods. And then also, because that'll trigger androgens, insulin response, sebum production, etc. Dairy, unfortunately, can be pro-acne for a lot of people, but
Mhm.
healthy for others.
And then look at candida and mold.
Yeah.
Yeah, great. Thank you, Dr.
Thank you.
Larivee.
Yeah. Thanks, Turds.
Bye, Turd. Thanks for joining us today. Stay tuned. We release episodes every 2 weeks.
If you like this episode, please subscribe and don't forget to rate and review us to help spread the Turd Nerd word. Eee!